Paracetamol, also known as acetaminophen in the United States and Canada, is a widely used over-the-counter medication for pain relief and fever reduction. While it is generally considered safe when used as directed, there are certain health conditions and situations in which it should be used with caution or avoided altogether. Always consult with a healthcare professional or read the label instructions before taking any medication, including paracetamol. Here are some health issues and situations where caution or avoidance is recommended. 1. Liver disease. Paracetamol is metabolized by the liver, and excessive use or overdose can lead to liver damage. If you have liver disease, you should use paracetamol only under the guidance of a healthcare professional, and they may recommend a lower dose. 2. Alcohol use. Drinking alcohol while taking paracetamol can increase the risk of liver damage. It's best to avoid alcohol or limit its consumption when using this medication. 3. Kidney disease. While paracetamol is primarily metabolized by the liver, it can also affect the kidneys in high doses. If you have kidney disease, consult your healthcare provider before using paracetamol, and they may recommend a lower dose. 4. Allergies. If you are allergic to paracetamol or any of its ingredients, you should not take it. Read the medication label and consult a healthcare professional for alternative pain relief options. 5. G6PD deficiency. People with glucose 6-phosphate dehydrogenase, G6PD, deficiency, a genetic disorder, should avoid paracetamol, as it can trigger hemolysis, breakdown of red blood cells. 6. Certain medications. Paracetamol may interact with other medications you are taking. Always consult with a healthcare provider or pharmacist to check for potential drug interactions. 7. Pregnancy and breastfeeding. While paracetamol is generally considered safe during pregnancy and breastfeeding when used as directed, it's important to follow the guidance of a healthcare provider and use it only when necessary and at recommended doses. 8. Children's dosage. Be sure to follow pediatric dosing guidelines when giving paracetamol to children. Do not exceed the recommended dosage for their age and weight. 9. Chronic use. Long-term, chronic use of paracetamol can lead to adverse effects. It's essential to use it for short-term relief of pain or fever and not as a long-term solution without medical supervision. Always read and follow the dosing instructions on the medication label, and if you have any doubts or concerns about using paracetamol with specific health issues or in combination with other medications, consult a healthcare professional for personalized guidance and recommendations.